Hi, my name is Wyatt Floyd, and I'm a licensed independent Medicare broker with Seniors on Medicare. And today, I'm going to talk to you about whether or not you should go on both Parts A and B of Medicare when you turn 65. Now, a lot of people think that when they turn 65, they need to go on both Parts A and B of Medicare, but that simply isn't true. And in fact, could be a really costly mistake for some of you out there. I'm going to give you an example with two imaginary people, and I want you to see if you can spot the difference between some of their choices. So let's pretend that these two people are turning 65 and they become eligible for Medicare for the first time. Let's call one of them John and the other Mary. Both John and Mary are still working and have health coverage through their employers. John thinks that he has to enroll in Part A and B when he turns 65, so that's what he does. He's happy with his employer's health coverage, so he decides he doesn't need to do anything until he loses it. Mary, on the other hand, knows that she doesn't have to enroll in both Parts A and B when she turns 65, so she only enrolls in Part A. Now 5 years go by, and both John and Mary are dealing with chronic health issues, so they decide to retire. Now neither of them have employer health coverage. John and Mary realize that there are some gaps in their coverage that they're left with, so they both decide to get a Medicare supplement plan. When John calls up a Medicare broker, he's told that since he got Part B over 6 months ago, he'll have to go through underwriting, where he'll have to answer health questions to get a supplement plan. He's also told that companies can deny him coverage based on pre-existing conditions. Mary, on the other hand, talks to her Medicare broker and is told that since she's losing that employer coverage, she now must enroll in Part B. But once she gets Part B, she'll be in her Medigap open enrollment window. During her Medigap open enrollment, Mary will have 6 months to enroll in a supplement plan with any Medicare supplement company offering coverage in her area and will not have to go through underwriting. She won't have to answer health questions that could disqualify her from coverage, and any company she chooses has to take her, regardless of her pre-existing conditions. So, did you spot the difference in their choices? They enrolled in Part B at different times, and this impacted when their Medigap open enrollment window took place. The Medigap open enrollment window is a one-time period that is triggered when you go on Part B of Medicare and lasts for 6 months. During this period, you don't have to go through underwriting, and Medicare supplement companies have to take you regardless of any pre-existing conditions. Now, everyone's situation is completely unique, and not everyone can delay enrolling in Part B when they turn 65. So one of the biggest pieces of advice that I have for you is to talk to a licensed Medicare broker before you enroll in Part A and B of Medicare. These people are free for you to use. They are a wealth of knowledge. They can help save you time and money. They can save you research that you're trying to do on your own. And my partner Jim has a video on choosing a Medicare broker. So make sure you check that out. I'll post a link in the video description so that way you can find some more tips on choosing a Medicare broker if that's something you're interested in. So let's go ahead and look at this list of scenarios where you have to go on Part A and B when you turn 65. We're going to talk a little bit more about why that is at the end of this list, so bear with me. Now, you have to go on Part A and B when you turn 65 if you're turning 65 and you do not have health insurance. Also, if you only have health insurance from a previous employer, and that includes COBRA and retiree health insurance. So this is somebody that you used to work for but don't work for currently. If you are insured through the healthcare marketplace or other private insurance that's not directly offered through an employer, you have to go on Parts A and B. If you have coverage from an employer with fewer than 20 employees, then you need to go on Parts A and B. And if you are insured by Veterans Affairs coverage, have TRICARE or CHAMP VA, you must be enrolled in both Parts A and B when you turn 65. Okay, so let's talk about the why. You have to go on both Parts A and B in these scenarios because it avoids gaps in coverage and you avoid penalties for delaying an enrollment. If you or your spouse has worked for 10 years and paid Social Security taxes, you also qualify for premium-free Part A of Medicare, so you may as well enroll in Part A when you turn 65. It's free. This covers hospital insurance. Also, in these situations, if you don't sign up for Part B when you are first eligible, then you'll face increasing lifetime penalties the longer that you delay enrolling. The penalty you face is an additional 10% in your Part B premium for each year that you delay enrolling. So that's a big one. And some of the situations that I went over actually require that you have Part A and B in order to keep your coverage. So you have to do it. Now, I told you that there was a situation where you could choose to delay enrolling in Part B, and here it is. If you are turning 65 and will have current health insurance from your employer, and you have a big employer, an employer with more than 20 employees, then you have the choice. You should still enroll in Part A when you turn 65, but you can choose to delay enrolling in Part B. Now, when you're making that choice to delay in Part B or to enroll right when you turn 65, there are a couple of things that you really need to pay attention to. The first are the costs. Secondly, are the benefits. So when you compare costs, you're going to want to pay attention to your premium. That's how much you're paying from month to month for your insurance. Compare your employer's plan with the Medicare route. A lot of people choose to enroll in Part B, and you have to pay out of pocket for Part B month to month in order to keep that coverage. A lot of people also choose to enroll in a supplement, and that's going to cost you a little bit more each month for that premium. So check to see what the differences are between the two. Maybe going Medicare and a supplement is cheaper. Maybe sticking with your current insurance is cheaper. You're also going to want to pay attention to the costs that you will expect to encounter when you actually use your insurance. Things like your deductible, things like your co-pays, co-insurance, your max out-of-pocket limit. So be sure to look at those things too. You're also going to want to pay attention to the benefits that each of these plans offer. What types of services are covered? What aren't covered? Consider your health history because that's really important. Some of you out there are really healthy and you're not using your insurance that much. So if it's cheaper to stick with your employer plan, then may as well do that and delay enrolling in Part B. So as you're probably gathering, there's a lot to dig through, not just when it comes to figuring out whether or not you should enroll in Parts A and B, but if you're one of those people who have the choice to delay enrolling in Part B, you got even more information to try to unpack. So again, my biggest piece of advice is to talk to a licensed professional. I strongly encourage that you talk to me. Right? Of course, I'm going to encourage that. A lot of Medicare brokers out there are really great people. They want to help. They want to make sure that you understand Medicare, the services that you get, and the benefits that you can receive. But there are some agencies that I'm not going to badmouth or anything, but when you give them a call, you're sent to a call center full of a sales team. They got a boss breathing down their neck. They're trying to meet sales quotas. So make sure you talk to somebody who has your best interest at heart. If you call me, you're going to talk to me, or you're going to talk to my partner, who incidentally is my father-in-law, Jim. We don't have a boss breathing down our neck. It's just us. We're going to make sure that we give you the best information, honest information. We're not going to try to push anything on you. We're going to try to make sure that you understand all of the options available, and we'll do our best to make sure that you are happy with the plan that you go with, whether you go with us or if you delay enrolling or whatever it may be. So I hope this video was helpful to you. If you do have questions, again, you can leave a comment. I'll get back to you as quickly as I can. But if you want to ask your question more privately, you can give the phone number that you see on your screen a call and give me a chat. Additionally, it really helps me out personally. If you like our videos, you can subscribe to my channel in order to get some more helpful Medicare tips. And again, thank you for sticking with me through this video. I know that this is a challenging time as you try to figure out this next phase of your health insurance journey. We are here to help. Give me a call. I hope this was helpful and have a great rest of your day. Bye.